So this morning we have our patient here. He has a severely ingrown nail on his big toe. As you can see, it's red, there's drainage, there's just a lot going on this toe, and it's quite painful, as you can imagine, for the patient. So we talked about some of our options, and we decided that we're just going to go ahead and remove the entire toenail and do a matrixectomy, which is actually removing the cells that produce the nail at the base so that the sides of the nail don't grow back, in hopes that this doesn't happen again. So the patient has been on antibiotics for about 7 days so that we can do the procedure safely without any risk of furthering an infection. It's already been numbed up. We've got our trusty toe tourniquet here. We're going to put that on. You can see he's very, very swollen, and that's just a result of these nails being very severely ingrown, as you can see. Okay. All right, so we've already cleansed the area off really well, but we're going to go ahead and just really clean off the site as best we can before we begin. So we like to remove as much of that debris from the sides so that nothing gets lodged in the skin fold while we're doing it. Okay, so quick test. Do you feel any of this?
No.
All right, so the patient should be nice and numb. We're good. Yeah. So again, we'll go through our typical steps. We like to use a variety of different instruments to get this nail off. We're going to be removing the whole nail. As you can see, this is so severely ingrown that the best thing to do is to remove the whole nail. We don't usually remove the entire nail for an acute ingrown nail, but in this case, it's just a very severe case, as you can see. So we work our way around the nail. We like to be as atraumatic as possible, and that gives us the best chance of growing a healthy nail after the procedure. So I always get asked, how long does it take for a nail to grow back? And the answer is, well, it's kind of variable, but you can usually count on anywhere between 6 months to a year for a healthy nail to grow back. So everything is kind of getting loosened up. So we've done it on the top of the nail, and now we start loosening everything up on the bottom side. You feel a little bit of resistance. You want to stay in the correct plane. That means you want to be right in between the nail and the nail bed. That's one side out. And there's the other one. All right, so the entire nail is out. And you can see that really did not give us that much resistance. That's because it was so badly ingrown and infected that the nail pretty much became unattached on its own.